Oh, don't stand behind any animal. Extreme reindeer run-ins, Christmas toy traumas, and holiday moments that go from cheerful to catastrophic in 2 seconds flat. Today, we're breaking down and reacting to all the wild, festive, and medically unhinged winter disasters from Happy Tree Friends. Let's dive right in. Ooh, cutting down a tree. I've never done this before. Make sure nobody's in the way when you're swinging that axe. Yeah, you just killed your friend. Interestingly enough, my grandfather took a hatchet to his head.
You know what a hatchet is, don't you, Bug?
And survived. It got stuck in his skull. Yep. We don't see too many axe injuries coming into the emergency department in Southern California because we're not using them that often. Yeah. Wow, they do a good job of showing us some brain matter. The face is split in half. You can have a lot of facial traumas but still be alive, but with this amount of brain tissue around, it's not survivable. And the eye rolling out. The eye would have to be severed with all of its attachments. Your optic nerve with blood vessels running through it, and then your 6 muscle attachments on the eye itself. It's really hard for the eye just to roll out of its socket. Never good. Oh, very common, happens a lot in the kitchen. We'll see people come to the emergency department with a laceration to their foot due to a knife falling on it, fork falling on it. A lot of times these are puncture wounds. Clean it out really well, wash it out. At home, what you could do is run it under water, under your sink water for a good 30 seconds to a couple minutes. We always ask when somebody comes to the emergency department if you've had your tetanus shot within the last 10 years. Not that we necessarily believe that you're going to get tetanus from this, but it's a access to medicine, so to speak, and we have the ability to update your vaccine, so we offer it. Wait, why are you cutting? He's trying to cut the flooring around so he can get up and move. Getting squished in this hole. Compression. His other leg is actually probably being dislocated, potentially fractured. Meat saucers flying around. Images of a CT scan. That's kind of how it is, where it slices in that type of direction. It goes every 5 millimeters. Here it's a little bit more. Oh. Half your body avulsed of skin off. At least you have striations here of muscle, but that's going to be painful as it gets pulled off. All those nerve endings. Uh-oh. Laceration to the neck. Lacerate major blood vessels. You hit your airway, and boom, you are done. Oh my gosh. Would it cause a total decapitation? Unlikely. I don't think that would be sharp enough to cut all the way through all that connective tissue and bone. What? Look at that. We got 2 different sized kidneys, which is fine. You can have 2 different sized kidneys. We got some other organs that are trickling down. We got intestines, and we're missing the rest of the half of the body. Not compatible with life. You'd probably bleed out and die pretty fast. Oh. Wow. Oh my gosh, that's actually kind of funny.
That's pretty funny.
You're losing that much volume of blood. It's not really compatible with life if you lose greater than 40% of your blood volume, especially fast, 30%. You're going to be really out of it and confused and not perfusing your organs very well. If nobody helps you, you're going to pass away pretty quick. Skiing down, oh my gosh. You gotta be really careful. A lot of ski injuries out there.
Everyone I know who skis is dead.
Broken bones, dislocations, and definitely head injuries. When it comes to skiers, because each leg is separate, you do increase the risk of ACL injuries, twisting injuries, versus snowboarding, usually a little bit less injury like that, but more big fractures that could happen. Oh no, oh my gosh. Impaled into the body, going through multiple organs, the intestines are coming out. What do? You take the ski off, bring the person to the hospital. Don't take the ski out if they're still alive. If you do take it out, there's a high chance they're going to die quickly. The other person where it's impeding the airway, and then you'd need to actually take that out to try to resuscitate. But again, your likelihood of success is pretty darn low. Yep. Oh, hey. Electrical injury with some unique anatomy. Look at the arms. The arms are the same bones up and below and just 3 ribs. Electrocution, there's cardiovascular abnormalities. They also cause breakdown of muscle tissue, injuring of your nerves, and frying your brain. Oh, geez. Oh, I actually had one of these. You like pump it up and down and it spins the orb and spins around. If insane scenes like these, or maybe your upcoming family gatherings, have your nerves lighting up brighter than a Christmas tree, that's where Chillax by my company Life Happens comes into play to help keep you calm, collected, and jolly when life gets overwhelming. Check out Chillax at lifehappens.com or on Amazon. Uh-oh, it's gonna take off. There goes your finger. What? That is crazy. It's never done that to me before. Skin avulsions, it does happen. We call them like degloving events. I've seen an individual skull due to car accidents. Very painful, and then increased risk of infection as well. Oh, and you get impaled with it? Come on. Come on! Solid impaled object, penetrating trauma to the chest, abdomen area. Hard to know, but unlikely compatible with life at this age. You have your stomach, the lower part of your heart, the aorta coming down in the thoracic cavity into the abdomen. I mean, trying to maybe do CPR. If you do have a chest injury, you potentially can still do CPR, but it will be very difficult. Oh, don't stand behind any animal. Black eye, you might actually even lose vision to that eye. You can have something called traumatic iritis. You can have a rupture to the globe where the fluid's coming out. That's not good. You can also get a hyphema, which ends up being like blood in the anterior chamber, and that actually can cause acute angle closure glaucoma. Oh. Teeth are flying everywhere. We'll see people come in missing a tooth because it traumatically got knocked out. Remember, don't wash that tooth off. Maybe put it in milk, put it in a glass of water, throw it in your mouth. You just want to keep it moisturized because there are special ligaments on that tooth that you don't want to scrub off. We will do a dental bridge. We'll either use some putty, something to splint it in place. Christmas time with Happy Tree Friends, always a good time. But this show, seriously, very creative with the injuries that they do show. I really hope that one day they will all come back and do more episodes. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.